So a warm welcome to everybody joining us for this evening session for the ISNTD and ADVA joint 3-day cross-sector synergies, looking at the commemoration of the ASEAN Dengue Day, which is today, and also the inaugural launch, the soft launch of the first World Dengue Day, which is also going to be taking place on the 15th of June moving forward. So a warm welcome to everybody. We've had a great 3 days. We've covered a lot of different topics, as you're all well aware, ranging from the pathogenesis, the molecular biology, the immunological landscape with dengue infection, roads out of that into treatment strategies. We've had vector control heavy presentations looking at the various mosquitoes that are responsible, the vectors that are responsible for the onset, the transmission of dengue. We've had some very, very interesting sessions yesterday looking at existential threats such as climate change, migration, emergency settings, conflict, and how they're also increasing the spread of dengue. It's really been framed as a global issue, and I think that's the take home. There is absolutely no way that dengue is something that's just confined to a certain region or the tropical belt. This is now everywhere. You would have heard throughout the 3 days, mainland Europe has in itself had autochthonous cases, outbreaks from the island of Madeira, Portugal, Spain, Italy, France. Dengue is here to stay, and that's a quote from Richard Allen, the CEO of the Mentor Initiative, who was on a panel yesterday and on our dengue advisory group as well. Dengue is here to stay. We have to adapt around that, and one of the key threads that we've picked out from the 3 days, right from the inaugural Indonesian Pediatric Society's Professor Alam, his talk, all the way through to, and especially from the ministry level input that we've had all the way through this, has been the importance of the community in terms of involving them, engaging them, mobilizing them, and moving this fight forward. It's an essential part of the overall integrated strategy, i.e. the role of the community. And it's something that we really wanted to pick up on in this particular session. I'm absolutely honored to be joined by the panelists today, and I'll give you a very quick introduction and we'll move forward. We have Dr. Hasitha Tissera from the Ministry of Health, Sri Lanka. He's joining us, he's been the first speaker in this particular session, looking at the grassroots community-led programs occurring within Sri Lanka at the moment against dengue. I think we have a fascinating insight into that. We also have, and we're delighted with this, representation of the Southern African Development Group, the SADC group, and their coordinating secretariat. They are responsible for the youth parliaments of 16 African countries. And as we've heard, not just in now, but in the previous sessions, it's a highly underreported issue, misdiagnosed. There's obviously resource issues, all sorts of negative issues around dengue when it comes to Africa, but it is there. We've heard from the Ethiopian CDC of an outbreak that they were managing over the last few years and the reemergence of dengue in Ethiopia. So we are very delighted to be joined by Maximilian Godwin, the head of the NTD task force at the SADC Youth Forum, and from the regional, and by the regional coordinator for the entire 16 countries, Mishek Gondo. They really represent the youth of Africa, and from our community perspective, a vital asset in the fight moving forward. Following those presentations, we're going to be joined by industry, as it were. We have Derek Wallace, the dengue head at Takeda Pharmaceuticals, joining us from the States, and also Jean-Antoine Zanzo, the country head, the country manager for the Philippines for Sanofi Pasteur. Very heavily engaged in all aspects of community, and it would be very interesting to have that Q&A and have that kind of have those different perspectives around community. In one of the previous sessions this morning, we had Professor Tingi Pangestu speaking really earlier about the kind of community mobilization. He was actually talking about what happens when we get it wrong or we don't engage. And he was really referring to vaccine hesitancy specifically. However, some of the points he made around the outreach strategies, the communication modalities, the advocacy, and the education awareness around those communities for dengue, vital aspects of community engagement, he made a very, very clear point. And he said, these have to be targeted, they have to be transparent, they have to be credible, and they have to be effective. And I think we are really going to pick up on that. Although he was speaking specifically about hesitancy, vaccine hesitancy, we want to widen that out to the entire community to cover all the kind of different roles it could fulfill and this kind of dynamic that's being set up between the healthcare providers and the communities and the governments. And so we're very looking forward to this in a big way. So that brings me to our first speaker. I had the pleasure of meeting Dr. Hasitha Tissera in a government-run dengue conference, which I was invited to speak as one of the international speakers there. And that was in Lahore in Pakistan, just before, it was in January last year, before the whole COVID kind of explosion had actually happened. And I didn't realize how much of a superstar Dr. Tissera was in Lahore, in Pakistan. Even though he's come from Sri Lanka, he was instrumental in helping. It was a great example of cross-governmental collaboration in terms of the first major dengue outbreak that Pakistan actually experienced back in 2011. They'd never seen anything like this. Dr. Hasitha Tissera was flown in as part of the task force, and they've had a huge impact working together, as you've seen from the Pakistan symposium, where they've had a massive impact on the CFR, the case fatality rate, and that is by engaging with community. There's all sorts of steps they put in place, including the dengue tracking system, all sorts of stuff. And so he's a huge star there. So it gives me a great, we met again in Geneva after that, but a great, I'm very happy, delighted to welcome to the floor Dr. Hasitha Tissera from the Ministry of Health, Colombo in Sri Lanka. So I think I'll hand the floor over. I think it's enough from me at this point. I think we'll hand the floor over to you, Hasitha. So I think over to you, and I'll back out of the video.
Hi there. Thank you, Kamran. Thank you for those kind words. So I'll be talking very briefly, giving you a summary of grassroots level community engagement activities initiated for dengue control in Sri Lanka over the last decade or so. Sri Lanka has successfully negotiated some of the vector-borne diseases, as you see in this slide. As such, malaria and lymphatic filariasis have been eliminated in 2016 and 2019 respectively. Japanese encephalitis has been effectively controlled using the live JE vaccination program in the immunization campaign. Dengue and dengue hemorrhagic fever continue to remain a major public health concern as of today. If you see this slide, dengue became a nationally notifiable disease through the integrated communicable disease surveillance system that is in place since 1996, which means that nationwide dengue was made a reportable disease in 1996. Since then, throughout the previous decade, case numbers have increased exponentially. You could see how the reported cases denoted by red dots in this map of Sri Lanka have spread geographically, covering the entire country. And more so in 2009, we had a massive epidemic of 35,000 cases and 350 deaths, giving a case fatality rate of 1%. Over the past 10 years, annual incidence has always been over and above 100 per 100,000 population, with the worst ever reported epidemic in 2017, with over 180,000 cases and 440 deaths. The case fatality rate, however, which was 1% in 2009, has gradually come down to 0.2% by 2017. Nevertheless, epidemiology of dengue in terms of both biotic and abiotic factors have seen a significant change over the years. I don't want to go into details because I have another talk later on. I'll touch on that more in detail in my next talk, but I'll move on to the next slide. In 2010, Based on the growing need for intersectoral collaboration, a presidential task force was established. This is the day that the task force was established by His Excellency the President. The task force brought together relevant ministries such as the local government, disaster management, public admin, education, defense, to work in hand in hand with the health ministry. This multidisciplinary partnership created at the national level nicely flowed down across provinces, districts, and the divisions, and finally reached the communities where acceptance has been very high. The overwhelming contribution in rolling out emergency response activities, particularly during outbreaks, has boosted successful community participation in vulnerable areas, using this model of a presidential task force, which was implemented in 2010. In 2004, when you go back in history, following a large epidemic, on the request of the Ministry of Health, the World Health Organization conducted an in-depth external review in Sri Lanka, which was the time that I was a registrar in public health. One of the recommendations of this committee that came from abroad was to establish a dedicated unit with an annual budget allocation for dengue control. Subsequently, the very next year, the National Dengue Control Unit was established in 2005. As such, in order to bring down and maintain a mortality rate below 0.1% from all the cases that are reported, and to bring down the morbidity level, a national strategic framework was developed with 4 pillars as given in this cartoon. It was robust dengue surveillance, evidence-based clinical care, advocacy and communication, and sustainable vector control were the main pillars of that strategic framework. A laboratory-enhanced Sentinel surveillance project conducted by us in 2010 to 2000, from 2010 onwards, in the field over a 2-year period, stressed that syndromic diagnosis based on clinical parameters and simple lab tests such as the CBC count was 85% sensitive in detecting cases. Also, it found that hospitals on average were dealing with 15% dengue hemorrhagic fever, or the most severe form of dengue infection in the community. If not for early diagnosis, these patients who get more severe disease would get complicated, leading to unwarranted consequences, and even they could die of the illness. Therefore, susceptible communities, especially in endemic areas, were constantly educated on dengue illness. I'll just highlight a few key points in educating the public. One of which was early healthcare seeking when fall ill with fever was made universal. Anyone of any age, if they have fever for 3 days, a CBC was made mandatory. So all healthcare givers, both in the public and the private sector, were expected to do a full blood count or a complete blood count on any individual having fever for more than 3 days. Non-steroidal anti-inflammatory drugs and steroids were prohibited from being used for fever patients, because that was a practice back then. Even for children, the non-steroidal anti-inflammatory drugs were given to bring down fever fast. But this was counterproductive and it was being banned. And since then, the usage has gone down. Patients were given very simple monitoring charts with warning features to immediately seek attention if they were given ambulatory care, because not all dengue patients need hospitalization, particularly during the early phase of the illness. So they were given ambulatory care with very clear instructions if they see any of the warning signs to come fast, rush into hospital. And green channels were open, as well as fever rooms were established in major hospital OPDs to cut down waiting time for those who are coming for the second time. And subsequently, small secondary care hospitals functioning without autoanalyzers and medical and pediatric wards of secondary and tertiary care institutions were given in-ward PCV machines that are seen, that is a picture of which is seen here. These machines, as well as portable ultrasound scan machines, were able to detect plasma leakage objectively in those who are coming to hospital. So middle-level doctors are now very confidently looking for plasma leakage in thoracic cavity and the abdominal cavity, and try to identify the start of the leak so that the management becomes standardized on those patients who have leaking. A more scientific real-time mapping system was established for better resource allocation as well as timely interventions in the last 10 years. A comprehensive scoring system was using the available epidemiological and entomological data with a local high-risk approach enabled the identification of the smallest geographic area for proactive action. Because of limited resources, we could not do cleaning programs or community activities in all areas, but those actions were restricted to high-risk localities. For example, some of the scoring tools that were used were population density, population of under 15 olds with dengue, the house index, the easiest indicator in entomology that can be used with least technical capacity, and existence of public locations such as schools, construction sites were included in identifying these high-risk localities. So this is one area where these geographic localities were identified, and they were used for in-depth community action. In response to this kind of action, source reduction activities for Aedes mosquito breeding was conducted over a period of 5 years, as shown in this graph from 2014 until 2018. With the Presidential Task Force providing a platform for both intra and inter-sectoral collaboration, additional manpower, which was scarce in the Health Ministry, was provided by the armed forces and the police to work in tandem with the public health officers in the field. Over the 5-year period, health authorities with military support, codenamed Civil Military Cooperation, or CIMIC in short, conducted door-to-door campaigns with the primary objective of ensuring mosquito breeding-free premises. With a short period, the active participation of the community was evident. Results were encouraging, with over 8 million premises inspected over that period of 5 years. And the Aedes breeding sites were gradually on the decline. In 2017, a unique activity took place where a team of mosquito prevention field assistants were recruited to the Health Ministry. They were mobilized in all districts to be dedicated for mosquito control activities with these SOPs that were given to them to conduct mosquito control activities under the subnational public health staff of the Ministry of Health. They were expected to work very closely with the community groups, including street committees that were established already, to engage in empowering the communities on mosquito source reduction activities. So that was one of the major activities. Here you see the recruitment day in 2017, where they were given their appointments for the first time. And this was a real, novel concept which had never been tried out for dengue control in Sri Lanka. With their help, a novel activity was initiated in all high-risk towns with a monthly collection of non-degradable products in the community by public health staff, and bringing together private sector recyclers who would buy the products from the public. Now, some of these were interesting because you can see the scrapped, warped roof gutters, which contribute immensely to dengue breeding during the rainy months. So they were scrapped because once they are warped, they collect water very easily. And once water get collected, they start breeding Aedes mosquitoes. So these are items that are collected on a regular basis now. And this allowed the people to, discard their items without much of a hindrance. Another interesting activity with the construction. In urban Sri Lanka, the population density is growing with a rapid and large demand for urbanization. Therefore, it has become essential to maintain construction sites free of mosquito breeding during the entire period of construction. Public health and built environment professionals have started to work more closely together than ever before to address this need of the day in the construction industry. Several larvicides, which were not to be the case previously, were approved to be used in stagnant water collections in construction sites and to be brought, contractors were able to buy them from the open market so that they can use them in water bodies which cannot be removed easily, because you need to cure water in constructions, particularly after concreting. And in such an instant, you can't simply get rid of that water. So therefore, these larvicides were very helpful in bringing down the mosquito density. And some of the construction sites were basically, in some areas, were 50% positive for Aedes larvae over and over again before this intervention was introduced. So this is a novel introduction, and it has really proven the benefit of working in tandem with the community when it matters. One of the other ways of getting a sustainable community level intervention, you need meticulous planning and holistic approach to implement such activities. Introduction of a mosquito inspection card through young school children as a curriculum-based activity was expected to bring about behavioral change in families, encourage greater community participation through regular inspection of their premises. So this was another school-based activity, and in fact, it was carried forward to the homes as well. In highly urbanized areas, homes were given inspection cards where the community was asked to inspect their premises within and outside once a week and mark the potential and positive breeding places that they found. And a public health officer would go once a month to see whether these cards have been marked. And here a picture at the below right is the schools which were identified as dengue-free schools. They were given certificates. The school children and the prefects who championed those activities were given certificates at the national level. Another novel activity was by developing a mobile application for the community to report fever in school-going children, which was another step forward in this activity of community engagement. And it showed a gradual change in the community to be more socially responsible through the novel campaign, which was regularly monitored by local and higher level public health officers. And this activity actually was a pilot project which really was championed by a private mobile company which developed this tool, and the parents were expected to report this any child being febrile even before they were diagnosed as dengue or considered as dengue. And clustering of more than 3 or 4 cases in a classroom would send an red alert to the class teacher that there is a problem within that class or somewhere near that classroom. So which would generate a momentum to clean that area with the support of the public health field officers. I'll take a brief time into touching on 3 ongoing research activities in Sri Lanka, which are enabling active community participation and sensitization. The Takeda vaccine phase 3 trial, Sri Lanka is a partner in that activity. We have recruited 2,100 children way back in 2015, between the ages of 4 to 16. And 4 years down the line, a phenomenal 98.2% of children still continue to be followed up after 4 years. And now I think the company is ready to give a booster dose, a 3rd dose for those children selectively. So that's another activity that has really taken effect on the community, which has really helped the community to understand the activities that is currently being tried out in terms of research to bring down this menace which is plaguing the community in urban areas in particular. The second activity is a pilot project which included Wolbachia, a bacterium, a naturally occurring bacterium, which is seen in other insects other than Aedes, of course, And here the Aedes mosquito eggs were introduced with Wolbachia, and then they were released into the community with the participation of the community groups. And there were active community engagement, including school children in the areas where the pilot project was carried out. And there was enormous support from the community for this activity as well. And finally, a randomized trial for spatial repellents in collaboration with Notre Dame University, USA is in progress. We have just got the necessary approvals. Transfluthrin, a common chemical compound used in mosquito coils, which have never been tested as a spatial repellent, will be used in this proper community trial, and we hope within the next few years we will get the results of this activity as well. And finally, making maximum use of the opportunity created to forecast, detect, and curtail outbreaks early. An evidence-based decision-making process was developed for dengue prevention and control in Sri Lanka. As mentioned by me in my previous slide, we worked on 3 dimensions: risk mapping, risk modification, and innovation, in addition to early diagnosis and treatment. So with this together, it summarizes a logic framework which we are using at present to the present day to bring down the effects of dengue in the community in the country. And thank you very much for giving this opportunity. I can take any questions later on. Over. Back to you.
Thank you very, very much for that, Hasitha. A very detailed look at some of the amazing projects that are out there. I see you've concentrated some of those around environmental management, indeed the schools as well, and this app system that you've got. It really kind of echoes a lot of the work that we've heard in previous sessions and the importance of community. So it's a fantastic to see that being a central element in the success that you've had in terms of reducing the case fatality rates down to 0.24%. It's an amazing effort. And I think questions on sustainability and the kind of questions that are going to, I'm sure there are already questions coming through, and we'll feed those into the Q&A. What I would say, so thank you very, very much for that, Hasitha, and we'll have you rejoin for the Q&A at the end. A great presentation, thank you for that. The next speaker is Mishek Kondo from the regional coordinator for the SARDIC group. And before, I'll just give a quick introduction to Mishek. We were honored, delighted, really energized by our engagement with SADC youth, the 16 youth parliaments across 16 African countries. We were amazed at the level of engagement being shown by the youth in those countries. Very organized and very willing and enthusiastic and ready to go. They really do represent a huge asset and a great, for me personally, a great inspiration in terms of what's possible within community engagement. Underlying that is a lot of, how to put this, operational, organizational skill sets. And I think that's really exemplified in terms of Mishek and our engagement with Mishek, and rightfully he's the regional coordinator for such a complicated setup across those countries. It's my great honor and pleasure to introduce Mishek Kondo, the regional coordinator for SADC Youth. So hello to you, Mishek, joining us from Zimbabwe, and I'm going to hand over the floor to you.
Thank you very much. And as we meet today, and as noted in the past days, that different stakeholders they have a role to play in terms of NTDs, in particular our discussion today, the dengue fever. And of course, from the SADC Youth Forum, which is an arm within the SADC regional body, we are not only engaging on this fight from an implementation perspective, but we are taking it from a policy perspective, just taking from our SADC Youth Forum that is held annually alongside the heads of states and government meeting. There was a deliberation that passed in the declaration that young people have got a critical role to play with regard to the NTDs and the fight against malaria. And today, like what I've alluded to, there's many approaches definitely that we can take to make sure that the young people are involved. And coming from the 16 SADC countries that are part of Africa, and I agree with Cameron that some of the diseases are actually underreported. And there's a lot of work that needs to be done in terms of research. And young people can come within this gap in terms of researching. We are talking of young people that are in the medical fraternity. We are talking of young people that are in universities. I think they can come in to come with data, providing data on how these diseases are underreported. Dengue fever exists among the people and is in many countries, especially in poverty-stricken areas, with children and young people being part of the most affected, if we look at that. And statistically speaking, if you look at SADC, we constitute more than 60% of the total population. These are young people between the ages of 15 to 35 years, without including the children that are 14 and below. So in terms of numbers, and these young people are also the most people that are also living in this poverty. There is a huge information gap about the diseases in many communities and countries. And it is very dangerous, actually, let me say, for communities to live with diseases that they are not aware of. And so this will result to many deaths, many maybe young people getting to disabilities, among other issues, because they are not, the information about these diseases is not available. The answer, some of the answers to the information gaps, prevention and control can be provided by effective involvement of all stakeholders, and with young people playing a critical and a central role in the fight against these diseases. Strategies can be proffered by young people. Some of the strategies that I'm going to highlight in my few minutes that I have, the issue of advocacy, by raising awareness and education at community level. And what are we saying when we are talking of community level? Community is divided into different sectors. We've got community start from an individual perspective. We have got a family. We have maybe the village. So what I was talking about is the aspect of mobilization, the aspect of advocacy, by raising awareness and the role that young people have at community level. And I was trying to just highlighting the aspect of how the community is arranged in terms of from the family level, from the individual level, the family level, the community level, then we go to provincial level, the national level, and the regional level. So if information is cascaded to the individual at community level about what is dengue, how does it affect young people, how does it affect families, that will be very important in the advocacy of making sure that everyone else is aware. The involvement of youth and communities in the fight, the control practices, the community participation itself. Another critical point is the mobilization of those local communities and active local leadership. You know, local leaders, they play a very important role in terms of information dissemination, also important in terms of buy-in of certain information. So the local leadership, if it is in some African countries, if we are talking of chiefs, we are talking of headmen, if we are talking of local business people, they need also to be acquainted, to be knowledgeable about some of these diseases such as dengue, and they play a critical role, but also with active participation of governments and non-governmental organizations, local-based organizations, community-based organizations for initiative for preventive strategies. Also community-based programs run by young people. Young people are so innovative. Young people, if they are given information, they can lead, involving local authorities as well, to participate in eliminating, for example, eliminating the breeding species for dengue mosquito. This will be cost effective because local authorities and people at community level are participating, and this is a sustainable way of ensuring that control of dengue is affected in countries. Then, in terms of at a policy level, there is also need to introspect to say how best can we come with effective policies at our countries. For example, in SARDIC, we have the health policies that are there in different countries. How effective can young people also lobby for their governments to make sure that the issue of neglected tropical diseases, the issue of dengue, is addressed at policy level? So the policy level, when the government commits itself to solve these issues, then you know that even in terms of budgets, when they are coming out with national budgets, resources are also allocated in addressing this. That's why it is important to be at policy level. Then also at regional level, for example, I'm talking of SARDIC, where I coordinate young people, the SARDIC level. When the heads of state, for example, when the department, the ministers for health are meeting, those are some of the issues that we are going to take through as the youth regional board, to say also how best they are going to discuss at policy level the support at this. Then at country level, I mentioned the involvement of health ministers, health institutions, the private sector. Also, we have the religious groups. The tertiary institutions also play a critical role, like universities and colleges, then individuals, as I have mentioned. Another critical factor, ladies and gentlemen, is the issue of training, capacity building. Are people acquainted? Do they have right knowledge to talk about the neglected tropical disease? Do they have a right knowledge about the dengue fever? So we need to make sure that as an advocate too, we also have some maybe short courses. We all have community interactions at schools, in colleges, and we have champions that now cascade that information at community level, that work with young health workers in these communities, and we promote evidence-based responses. Then we ignite the application of innovative and sustainable solutions, for example, in areas that dengue fever is affecting. Also, preventative measures are very important, because we should not wait for dengue to affect communities, but pre-sensitization, so that communities, they are aware if they have got some individuals have got some symptoms. When they visit the health institutions, they will be able actually to respond accordingly, because they have the right information. Some of the tools also that can be used, young people are very good in terms of use of technologies. How best can we use technologies in the fight against dengue? How best can we use social media? How best can you use mainstream media to fight dengue? Also, how best can we use arts and culture? If, for example, community drama groups in the communities, how best can you use local musicians to sing about dengue fever? So there's a lot of things that you can do to promote the knowledge and the information about dengue. My colleague, Maximilian, will talk about some practical issues which we are doing at community level. But before I conclude, Cameron, I need to highlight these critical factors, the collection of information, like having data, but also we also have another tool that we have, like what I highlighted, the SARDIC Youth Parliament on policy issues that can also, within where they represent different parliamentarians in their country, they can become advocates as well, but working with local young people in terms of key policy changes, but also engaging the ministers of health, engaging the health institutions in coming out with key strategies and best responses that we can do collectively. But also using the tools. Some of them I've highlighted. One of the tools is engagement, both at country and regional level, but also community mobilization, social media, mainstreaming, podcasts, short videos, news bulletins, for example. But what is also important is the use of local languages. We need to translate this information to be understandable at local level, so that people, they understand in their local languages. If we are in Tanzania, if we are in Malawi, if we are in Zimbabwe, they'll be able to relate with the information that we are trying to bring. Some of the aspects that we can use is the issue of essays, journals, if it is colleges, articles, debates in schools, universities, also use of young celebrities and influencers to fight dengue. My last point on this note is the emphasizing on making sure that governments, they put resources in their budgets to fight dengue. Governments, they put budgets, budget allocation to fight neglected tropical diseases. Then I have these key statements that I need to conclude with. Mobilization of community at the level of family, village, community, national, regional level is effective in prevention and control. Community mobilization, but however, it requires decentralization of resources and powers. There's need of high-level coordination among stakeholders to realize the fight against neglected tropical diseases, in particular dengue. Also, effective coordination among local communities, young people, the government, agencies, NGOs, local leadership is vital for effective implementation of dengue prevention. And lastly, young people play a very important role, not only as mobilizers, but as stakeholders, stockholders, leaders for transformation to fight dengue. Thank you very much for this opportunity, Kamran. Back to you.
Thank you very, very much for that, Mishek, in terms of that kind of quite in-depth look in terms of the potential role of youth in various settings. I think you made a very big, huge point that the youth are not just the stakeholder for advocacy, but potential leaders, champions. All of that's going to add to the sustainability of any kind of engagement. I think you made that point very clearly. So I really appreciate that, and thank you for that. And drawing from your experience of working across 16 African countries, I think that's a very interesting insight. And I think there'll be a lot of questions that will come through in the Q&A around that. So thank you very much for that. Turning now to our third presenter, still with the SADC Youth Forum, the head of the NTD's malaria task force, and dengue is included in that, is Maximilian Godwin. I'd had the pleasure of meeting with Maximilian, engaging with him about a year and a half ago, and we were discussing really and putting in a Southern Tanzanian education awareness kind of program, which he was actually running at the time, around dengue, going into schools and going into various universities and teaching about transmission and that type of thing, and what youth could do at that time. So I think you've got a wealth of grassroots experience, Maximilian. I think we're very honored to have you present this bit. So over to you.
So thank you so much. And I'm so happy that everyone here has joined to call for the global concentration of our country, that we now need to focus on ending dengue as one of the neglected tropical disease, but also welcoming the World Dengue Day, which is very important to our countries, especially in our especially in our SADC region here in Africa. So we are so happy to be part of this, and I'm glad to share with you some of the inputs from us youth, especially in African countries based in our SADC region. So, by starting, so I think our regional coordinator has tried to take you around to understand what the SAI of SADC is. So SAI of SADC is our regional youth body for youth and youth organization in our SADC region. And now, hopefully, after I'm repeating, you can grab our concept well. So during the second Youth Forum Declaration, among other resolutions, the young people led by the Able Health Committee called the member states to effectively comply to the new WHO NTDs roadmap. 2021 being the momentous years for NTDs, SADC Youth showed an example by leading a special campaign aiming to increase the awareness of the NTDs to the SADC member states, communities, via several platforms. On 28th January, during the World NTDs Day, SAI of SADC made a statement bolding the launch of the new NTD roadmap and committed to establish the SADC Youth Task Force on NTDs as a better way to inform youth and associate youth in combating NTDs in the SADC region. SARDIC Youth Task Force on NTDs is a group of young people under the SARDIC Youth Health Committee from all SARDIC member states assembled to address the neglected tropical diseases. So why did we decided to form this task force? So that we can now see the reasons for forming the task force on NTDs to address all neglected tropical diseases, including dengue. So the first thing was to highlight areas of NTDs that need the most and immediate attention. For example, currently, can you hear me? Yes.
You're all clear, Max. It's all good. You're clear.
Okay. So why we decided to form our task force? So the reason for forming task force as follows. One was to highlight areas of NTDs that the most and immediate attention. Let me repeat here, highlighting areas of neglected tropical diseases that need the most and immediate attention. We all agree here today that dengue, as one of the neglected tropical diseases, need the most and immediate attention from everyone in our society, from everyone in our country. So to increase the health committee focus on NTDs. So we wanted why we formed this, because we wanted our committee of the health committee to increase the focus on fighting NTDs, but also to increase the efficiency of combating all neglected tropical diseases. And the last thing was to increase the chance to concentrate on major areas of interest. So why we formed our task force was also to increase this. Now, engaging the communities. Now, how do we engage the communities? The first people that we think we need to engage them are youth. Considering youth take big numbers, especially in our SADC Africa, in our SADC region. For example, in Africa, in SADC region, 60% of everyone here is youth. So if we include youth, if we engage youth, we are pretty sure that everyone in the society is going to be sensitized with the areas of dengue and what everyone can do. But we also plan to engage individuals directly affected by neglected tropical diseases. In our African countries, we know some of our friends, some of our colleagues that have suffered dengue and other neglected tropical diseases. So we want to discuss with them to understand from their perspectives and their experience of suffering dengue, how it was, what should be done, and kind of thing. Like, and the third thing is those working with those affected with NTDs. We know that there are healthcare personnel that are working on daily basis to ensure that they are managing dengue patients and other neglected tropical diseases patients. So engaging them gives us knowledge on how to prioritize our actions, on how to better send our focus. And the third thing is government officials. We really understand that everything needs a political will. So if we need the political will, that means we need the government officials to be in front lines and to be engaged. The third thing is partner organizations. There are many organizations in our countries that are working around dengue areas. So we really need to involve them. And the last part, to engage stakeholders, including member states and partner organizations. One thing for sure is that, for example, last month we as SADC, we were having this kind of consultation meetings with the Parliamentarians Caucus on NTDs, especially here in our country, to assess their interest and ways that they can influence policies around neglected tropical diseases. So we understand that with their position, they can help us to penetrate many of the agendas and to increase the ministerial concentration around dengue and other neglected tropical diseases. But we also look to involve business leaders, clergy and other faith leaders, local and state officials, people having high standings in the community, people having access to money and resources, people with power, people with access to target population. So we believe that if we engage even this kind group of people, we will be in a position that everyone in the society to understand the areas of dengue and other neglected tropical diseases. Yes. Now, what have we done so far? I would like to take you around on things that we at SARDIC Youth, we have did for the time being. For example, we have been conducting awareness campaigns, and that has been seen also through our media platform. So we have been doing media platform engagement and sending awareness on that. But we really understand that most of the affected with these dengue and other neglectable diseases mostly are those living in societies, in the local societies. So what we have been doing using local radios and local televisions that we believe that we can reach the targeted audience. But more to that, we have been doing these outreach programs. And here I would like to tell you one thing, that especially here in my region where I'm staying, in the southern part of our country, I have been visiting schools, and we have these dengue clubs in our schools. So it helps to activate our students to understand that they are in a position to fight dengue. For example, I've been telling them that the approach that we are using to fight other most vector-borne diseases like malaria, we should also use the same approach in fighting dengue. So we have been educating them, letting them aware of what is dengue, how is it transmitted, and everything. So we are pretty sure that our societies are doing that. And as I've been going to the schools to visit them, you see the level of understanding among the students is growing, and they can now tell you different stories. So they really understand dengue, and we are pretty sure in all schools here in our southern region, they really understand what is dengue. They really understand what is dengue and every aspect of dengue, and they are really they are taking precautions to ensure that they are not suffering dengue. Yes, now let's try to see challenges around dengue disease. So through our activities that we as SADC, we have been doing in our 16 countries, and especially here in Tanzania, as I've been doing and as I've seen people doing, we have seen the following challenges. First one is awareness gap. People confuse dengue with malaria. So people really fail to differentiate. But also there is the challenge in data gap. So if you'd like to find cases of dengue, if you'd like to find how far dengue has affected people, there is data gap, but also there is misdiagnosis in healthcare facilities. So in our healthcare facilities, dengue is totally misdiagnosed. You can find that doctors sometimes they prescribe for a dengue patient, you may find them prescribing as a malaria patient. So there is a really problem in diagnosis and also mismanagement. So you can find that these dengue patients, they are totally misdiagnosed and ending up receiving treatments for the things that they are not suffering, but also unskilled healthcare professionals. So you may find that most and many of the healthcare professionals do not really understand, do not really have enough skills on managing dengue cases or understanding or differentiating that this is malaria, this is dengue. So there is still a problem with that. But also a less availability of medication for dengue. I've gone through different healthcare facilities and I've never came across, and I've never came across with treatment for dengue. So I think there is a big challenge in availability for medication for dengue. And also we do not have dengue vaccination or vaccination program for dengue. I think that is the other problem around dengue. And as we are calling for World Dengue Day, we really need to think of ensuring that we are now focusing also with dengue vaccination programs. Also, now let's try to see the opportunities that we may try to harness around dengue. So here I've tried to show you some of the opportunities that I think we can try to harness them. One is awareness program. So we really need to invest on awareness program, as we have been doing especially in our SARDIC region. So knowing that there is a problem, knowing that there is a big problem in awareness programs, so what we have been doing is increasing the awareness through different approaches. So I think everyone in our SADC region now, we are calling them around to increase awareness programs. But second thing is research. So having dengue as a global burden, it's now we are welcoming for research research firms now to do a lot of research around dengue. But also we see an opportunity in training institutions to increase knowledge on that. But also in pharmaceutical industry, that means pharmaceutical industries now, they may support us in finding medications, vaccines for dengue. But also integrated approach, as we have seen that dengue is a vector-borne disease. So now we may try that. To see if we can align it with other diseases procedures that we are doing. For example, there is high concentration for malaria because we have seen it killing many people. Now we need to see an integrated approach because it's a vector-borne disease, malaria is a vector-borne disease. So other issues, other ways that we are using in fighting malaria, the same ways I believe we can use in fighting dengue, like use of nets and kind of thing. Yes. Now, on my closing remarks, I think we need to influence and increase the country ownership. For example, us in our country now, we are, us in our country in Tanzania, and we are working it in all SADC region. What we are working now is to ensure that as youth, we influence our ministries of health to prioritize research around dengue, to prioritize their concern around dengue and other neglectable diseases. So on my closing remarks, I would really like to ask everyone us here to remain committed in research, to remain committed in giving awareness, to remain committed and ensuring that the researchers around dengue, the awareness around dengue is there. And we call for World Dengue Day. What I believe is that having a World Dengue Day will increase concentrations and the government's efforts on fighting dengue, as we have seen now, it's the fastest growing vector-borne diseases. So many people will save many lives, and we will ensure that the healthy of everyone the health is in our priorities. Yes. So I'm calling everyone to share the World Dengue Day campaign and sign the petition, and make sure that you share through your connections, and everyone should be aware that we need to sign for World Dengue Day petition, calling for the global health leaders to think of this, and I personally welcome a World Dengue Day, and thank you so much.
Thank you for that, Max, and apologies, I came in too early, I think, at the end. A great overview in terms of the challenges, the gaps. You mentioned some around training, education, and also the opportunities there in terms of this development of champions, the driving of sustainability by using the youth. So I think there'll be quite a few bouncing questions around in terms of the Q&A at the end, but thank you for that. There's been some comments from the audience. So Dr. Karam Wahid, thank you for the in-depth overview of NTDs in African countries, an impressive contribution of youth there. This sense of ownership of this disease and many other diseases, but in particular, obviously, dengue we're talking about today. So there is this sense of ownership that's developing there, and it's really being led by the youth across Africa. So thank you for that. That brings us to the end of the presentations, and I think you heard there in some of those slides there that we need better in the harness opportunity slide to harness industry, as it were. And you've heard not just here but throughout earlier sessions how industry is engaging with community in terms of the spatial repellents, in terms of this whole the massive RCT that Dr. Mitra Elahi was talking about. on the first day, where they're looking directly at targeted vector control activities, fogging, bringing those kind of issues into the community and assessing community engagement. One of the biggest success stories of this year has been Wolbachia, and I dare say the Wolbachia program is underpinned to a large extent. Its success is underpinned by the very high level, very robust community engagement that they put in place as part of their strategy. So it's a vital cog in the overall integrated approach to dengue. And I think industry does have a role to play. And so it's my absolute pleasure to give the floor over to Jean-Antoine Zanzo from Sanofi Pasteur, the country manager, the head of the Philippines for Sanofi. But a very long-standing relationship with Jean-Antoine in terms of professional relationship, with various meetings and various symposia, webinars, face-to-face meetings for some years now. And I've always been kind of, the thing that's always struck me about Jean-Antoine is the approachability, and I think that will lend itself very, very well to community-based projects. So without stealing any more of your thunder, Jean-Antoine, I think hello to you, and I think I'll pass the floor over to you. So thank you. So say a few words. Yeah, thank you.
Thank you, Cameron, for this kind word, and hello, everybody. I hope you can hear me well. Can you hear me well?
Yeah, perfectly. Yeah.
Okay. So, you know, for us, Sanofi, the patient centricity is a must, and especially in the vaccine world, where people need to be convinced of the value of vaccination before accepting to be vaccinated. And in the past, we were relying almost 100% on the healthcare professional to have this conversation on immunization with their patients and get them vaccinated. But nowadays, people have a direct access to information. Doctors are now used to confirm an information found on the internet. They are not anymore the primary source of medical or scientific information. And this phenomenon was amplified by the ongoing pandemic due to all these lockdowns and confinements, etc. And therefore, the pharma industry needed to come up with new models to achieve direct communication or conversation with patients. Hence, the increasing number of web pages run by pharma companies. But outside the digital world, the pharma industry doesn't have the know-how and probably doesn't have the legitimacy to directly engage with the lay public. In most of the cases, we have to develop partnership with NGO, governmental institution, or any entity that is already well introduced in the targeted community. And I would like today to share with you an experience that we had here in the Philippines. In 2019, we launched a project named Youth Health Patrol. And we partner with an organization called CACHE, which stands for Campaign for Character Education Tenacity, and a partnership also with the Department of Education. And our objective was first to support the Department of Health Dengue Awareness Campaign by developing a multi-stakeholder community-based activity. Second, to develop group of influencers, advocates to disseminate the right message through word of mouth. And third, to empower public school students in taking a proactive role in promoting health and wellness in communities. And the mechanics of this initiative was very simple. Each invited school had to propose a team of 8 or 10 members to qualify. And this team has to plan and implement a 3-month creative campaign that follows the DOH4A strategy against dengue. And the campaign had 2 components, an offline component to be implemented inside the school or in the school's immediate neighborhood, and an online component via social media with an active Facebook page stamped Health Patrol. And each team was assigned a Youth Health Patrol mentor to monitor the team progress based on timelines and milestones provided. So in 2019, when we launched the first session of this Youth Health Patrol, we had 29 schools taking part in this initiative involving 250 students who came up with 8 projects. But this year, we choose to involve students on COVID-19 and its prevention. And therefore, we had 78 participant schools involving not only 250, but now 694 students who proposed not 8 projects, but 30 projects, 30 projects. It is amazing to see how these students were able to mobilize their community, including high-ranking politicians they convinced to be interviewed. And the beauty of this project lies on the constructive collaboration between the pharma industry, whose objective is to disseminate the right information on disease and disease prevention and treatment, the government and non-governmental institution, whose objective is to promote the right behavior, and the youth, in their desire to engage themselves in a project that serves their community, giving them a sense of being useful. And because, as each of us, youth belong to several communities, school, church, neighborhoods, sport club, working with them give us an extended reach and impact, as they also are key family influencers and they have their social network. So through our initiative, we encourage them to join the community of vaccine advocates. So to conclude, I will say that for us, community is an inclusive concept, not an isolating concept. We all belong to several communities all at once. Therefore, when we reach out to one given community to work with, we know for sure that we will reach more than one community. When it comes to dengue, the disease is so complex and preventive measures so diverse that to elicit the right behaviors in terms of disease prevention and control, a top-down monocentric approach won't work. A peer-to-peer multi-sectorial approach is a must. And the pharma industry is really ready to play its role as public health partner, but won't be able to achieve the awareness and behavioral change objectives alone. We need to join forces to be successful. So Cameron, this is what I can say to start with, and I'll be more than happy to answer to any question that will be raised in the Q&A session.
I think that was a fantastic overview there, and in terms of your position, as it were, and some of these kind of the schoolwork that you've been engaged with, and some of this huge success really in terms of the students themselves coming up with 30 of these projects. I think we really appreciate that kind of honesty, Jean-Antoine, in terms of the bottlenecks, the skill sets are not within pharma, they're kind of outside of that, and harnessing the desire of the youth and look at some of the results that are coming through on that. I mean, that's fantastic. I think it's a very interesting dynamic being formed. You have on one side the Mishak and the Max and the kind of representing the youth, really showing that they need more business involvement, more industry involvement, and whilst on the other side, industry saying they need more involvement by the youth and by these communities. So it'll be interesting to see what kind of tips can be shared, as it were, but we'll come to that in the Q&A, but I really thank you for that input there, Jean-Antoine. That brings me to Mr. Derek Wallace, the dengue lead for Takeda. I had the pleasure of having Derek and Jean-Antoine on a panel at the United Nations General Assembly side meeting that we had for dengue a few months ago, about a year ago, I think, well, last year, over the last a few months ago. And some of these issues were being unpicked at the time, but more through the optic of vaccine hesitancy and confidence. But Derek, I know you're joining us from the States, so I really appreciate that. It's very early start for you. But would you like to share a few kind of words in terms of Takeda and community and what it means to you for dengue?
Thank you, Cameron. Can you hear me okay?
Yeah, we can hear you and see you perfectly. Yeah.
Awesome. That's great. Thanks. So good morning, good afternoon, good evening to this dengue community. It's a real pleasure to be a part of this important discussion. At Takeda, we understand that community engagement is absolutely vital in improving public health. Dengue is a global problem, but the solutions are likely to be local. Jean-Antoine and the other speakers, Max and Asifa, have talked about the need for partnership, and we strongly believe in the need for partnership. We need to work industry together with governments, with local health authorities, with community leaders, with schools, with the youth, with other partners, to firstly understand the needs and the characteristics of communities, so that we can then tailor the solutions to those specific communities. I think the good news in all of this is that there are a large number of dengue champions, and really we need to find a way to work together to find a solution to this very important problem.
Thank you for that, Derek. I think you made a very big point, a huge, profound point there, that it's a global problem, but the solutions are more than likely to be local. I think that's a fantastic soundbite in its own right, but I think that's the crux of this particular session. So I think with that, I'd like to thank you for that. And we've seen some very technical presentations in the Tequila Symposium earlier in terms of the immunological granularity of it, of all of that. But I think these issues, when you translate to real world, these are going to be the things that define success of any kind of engagement and fight against dengue, the involvement of the community. So on that basis, I'd like to bring back to the floor Dr. Hasitha Tissera, if you're still there, I hope, Mishek and Maximilian for a bit of a Q&A. And I would say to the audience, please do feel free to bring in, to send in your questions in terms of questions specifically for the panelists, whether that's individual questions or general questions. We can feed those in. Absolutely no problem to do that. I suppose I was going to start the Q&A with a kind of definition of community, but I think, would it be fair, what's your take on community? I think it's quite fair to say that all of you have really highlighted a kind of a fully inclusive, how to put it, definition of community. Would that be a fair point to make? That is not in isolation, or your definition, Hasitha, in terms of community, what would it cover?
That's an interesting question, Kamran. Just to make a few points before I come to conclusion. Originally, when dengue really became a problem, our community was tire traders, and then it was the housewives, because those were the target populations that we really aimed at. So gradually this, community grew from strength to strength, and basically now it has become all people. So with times, the community really changed. It's so dynamic. It may be the children, it might be the adults who are more vulnerable when they go out, like they see in Singapore. So communities do change. They never stay static. But here we are talking of a disease that can affect everyone. So basically, everyone in the community is a target.
We're all in it. We're all in it together. I think that's a very fair point. I suppose that would be expected as an answer, in a way, from the Ministry of Health, who are responsible for the health of the nation. So I think that's a very apt answer, and a great answer. In terms of, is Mishek and Maximilian there? I can't see you there. I don't know. Are you still there? Have you dropped out of connection, or? Max, in terms of your... So Mishek, great. Sorry, I couldn't see you there on my screen. So in terms of the... so firstly, thank you for that presentation, Mishek, earlier. I think that was great. Your focus, obviously, we keep saying youth task force, youth. What's your definition of community?
Thank you very much. My definition of community, this is where we have different people, different stakeholders living in a particular area, but also for a particular purpose or for a particular cause. This can extend to the issue. A community can be a village. A community can be an advocacy group. For a particular purpose, a community can be a nation itself. It can be a community. And at a regional level, for example, us as young people can be a community. So this definition, why I was giving at different level to say these are different communities. These different communities, they have different needs, and they have different how they live. And so it is very important if we are aligning that to the issue of dengue advocacy, to say what kind of a community are we targeting. If we are targeting a village, we know that the village, they've got these challenges as a community. If we are targeting a political parties as community, we know that how best are we going to involve them. This is how I can define the community. Yeah. Thank you.
I think that's a great answer, constantly evolving. But within that, obviously targeted areas that you're working on in terms of engagements. In terms of, we have a situation here, if I'm honest with you, if you look at this, where you have, on one hand, you have kind of industry saying we need to engage with communities. On the other hand, we have communities or community-led or representatives of community kind of, so in this instance, the African youth as an example, saying we need more input from industry or private sector. So I guess I'm going to ask you this question. So I'm going to spin this the other way and ask Derek this first and then Jean-Antoine. From an industry perspective, someone looking to engage with community, what would kind of tips would you be able to give to people such as Max, such as Mishek, who represent a massive amount of the youth desire to engage and combat these diseases, dengue in particular? What would be the tips for them to engage with you?
So the first thing I would say is that we're very keen to engage. We're very aware that this is not something that can be done without partnership. So I think that we want to also understand how best to engage. We have a large number of different pieces. How do we put those pieces together to be most efficient? We can cover some components of that. So things like education, I think, is a key one. Providing clear, transparent data, so that healthcare professionals or whoever it is that communities trust can actually be well informed. And I think, Cameron, you mentioned a previous panel where the things that were mentioned were information has to be targeted, transparent, credible, and effective. So I think that industry can provide that kind of information. In fact, at Takeda, we have a website which actually launched yesterday called Dengue Academy. And the purpose of this is to provide information that is both global but also local, that is providing background information on dengue, on the diagnosis of dengue, the symptoms of dengue, but also potential solutions to dengue. I think we work in a data-driven world, and a lot of the partnerships that we want to create are essentially almost localized studies. How do we best use the tools that we have available? And that could be vector control, it can be personal protections, it can be vaccines. How do we combine those together to and demonstrate the value of that combination? So really coming to us with that approach, we'll certainly meet you halfway. But I don't want to suggest that you have to come to us. But the whole point is that we have multiple tools. We have very complex environments. We have a very complex disease. How do we best use those locally to have the most impact? And thinking through that combination.
That's a great answer, and I'm very excited to hear about this Dengue Academy, actually, Derek, as well. I'm sure we hopefully get some links put up in the chat, or we will do after in terms of when we put this asset out afterwards. That's a great answer and something to coalesce around. Jean-Antoine, if I could ask you the same question, and then I'll ask the panel, and then I'll ask Hasita and the other panelists. You've got experience. You mentioned this schools project that you had, and the kind of not shock, but you kind of the positive response from the students. You asked them for a project, they gave you 30 projects. What kind of tips could you give for any kind of community representation to engage with industry? What should they be doing from your experience?
I mean, from our experience, I say from the Sanofi Pasteur experience and Sanofi in general, we consider ourselves our public health partners of the health authorities. So the first thing that we do is to enter into a dialogue with the health authority to see what are their objectives in terms of awareness, etc., and how we can complement what they do. And it's only when we agree on what needs to be done that we reach out to the more relevant NGOs or institutions that can share the same objective, and we can, collaborate together and bring up this type of programs. As you've seen, it's a partner. The program I described, the Youth Health Patrol, is done with the partnership of the Ministry of Education, but also the Ministry of Health. For us, it's very important to be aligned with the strategy of the government and really to reinforce the message of the government, because it's by doing that, instead of duplicating or having different initiatives, that we're going to reach the objective, which is to put dengue under control and elimination.
Well, that's a fantastic answer, and it's not just aligned to the government. I'd expand that and say that's actually aligned to the WHO's own position. Their guidelines for NTDs, and dengue is one of them. One of the massive shifts to their 2030 plan, the guideline map to 2030, is that they really want to encourage country ownership of diseases, and within that, political leverage, so the political will to allocate resource into that, and at the same time kind of really boost the local involvement. So that's not just country alignment, it's also the WHO's alignment. So that's a very interesting take on that. Hasitha, from if I could ask you that question, you mentioned how you've seen this evolution of the target kind of communities from the TIRES, the built environment type of environmental management type of communities, into schools. Is there more the government can be doing in line with what you've just heard from both John-Antoine and from Derek?
The main challenge, Kamran, is the sustainability of all these projects and interventions that we think are, working at the grassroots level. So that's really challenging, because the ownership needs to be, shared. Unless you do that, it becomes a kind of a very narrow spectrum of events. I'll give you an example. The student curriculum is already overcrowded. So to bring in an element of dengue-related thing in an overcrowded situation is not an easy task at all. But you can have a holistic approach from an environmental perspective, from a community perspective. You have a holistic way of getting into that habit of looking at things in a more broad way. I think you reach there. It need not be dengue. Even for construction industry, that was our main goal, not to get them to do what we want, but for them to understand what they should be doing in response to their environment. Because construction, for example, is they are not mindful of the immediate environment in terms of the sound, the dust that it creates, and all those anti-communal activity that goes on a construction site is kind of non-observant or non-existent for the construction industry, because that's how they thrive. But if you make them inclusive and try to get them on board to understand the problem and to be part of the community that they work in, it becomes so much better, and it becomes their problem and they are inclusive of the problem. So that's not easy. I mean, that's not easy. You can say it, but then it needs a lot of effort. You need to have them on board and work through and make them understand. I'll bring another example. The school app, which was introduced in certain schools for parents to report when their children are ill with fever, was initially considered a sort of no kind of thing. But with time, they realize it's for their own benefit, and they very proactively started responding, and even the parents were talking about it at the school. So there were seminars and discussions along the lines of this activity, and then they thought it was a very proactive intervention, which were trying to make the school environment of the children better. Over to you.
Yeah, oh, that's a fantastic answer. The subtleties of sustainability, really, this whole concept of ownership and how that could push things forward. That's a great answer. In terms of that sustainability, I'd switch that question back to Mishek and to involve Max as well. you alluded to something earlier in your slides, and I'm talking about the sustainability issue within community engagement that that Jean-Antoine, Derek, and Hasita have just come up with there, was highlighted there. What's the role of the youth? You mentioned earlier they're not just an advocate. What I'm trying to say is you need champions for sustainability. You need ownership, and within ownership, you need then to, from that ownership, you need to develop champions to further the cause. What's the role of the youth in that? To Mishak, I think. And then Max.
Okay, thank you. Yes, thank you very much for bringing that question. You know, the role of youth in terms of that is very critical. And one of the things that we also need to understand when we are talking about young people, especially when we are using what we call our youth development model, is young people, they are not described as a homogeneous group. They are different. We've got young women, we've got youth with disabilities, we've got young people that are students that are in schools. We have got different types of young people. We actually have 16 definitions of young people. So when we are defining their role as young people, we need to understand that these different young people, they've got different roles. For example, the young people that are in the community of students, they can take a role in terms of pushing the academic, maybe pushing the research for dengue. They can also do awareness in colleges. But if you are talking of the role of young people at community level in rural areas, they need different capacities so that they become advocates. When we transform them to become advocates, they can be influencers to their fellow young people in terms of information. They can work with community health workers. I also need to articulate the issue of young people that are part of health workers. These are some of the young people that work with, and they are part of our task force as well. Yeah, I'm talking of nurses, I'm talking of pharmacists, I'm talking of medical practitioners. They are part of SARDIC Youth Task Force on NTDs and malaria. So these young people as a community, they also have a role to impact knowledge about these diseases. Because these young people, they've learned about these diseases. They also practice, they also, participate in terms of prevention. So they've got a critical role. To make a conclusion, young people, they take a different role at community level, both in terms of information sharing, in terms of capacity building, in terms of lobbying the community leaders, in terms of advocacy at national level. I take, for example, the artists at community level. They can even sing about them. So young people, they play a critical role, different roles within their realms of influence. And it's all about if information is available to them and they are able to grasp and understand things that needs to be done.
That's a great answer. Thank you, Michelle, for that. Thanks for that. Max, what would be your take? You're working directly with some of these communities in terms of your school's outreach. And I know you've been doing some outreach into medical schools themselves, not just primary schools, secondary schools, but university level communities as well. Max, what's your take on that? You're muted, Max. Sorry, you have to unmute. Yeah.
So my take is that first youth need to understand. So one thing that we have been really investing is for youth to understand dengue and its impact. So when they really understand what is dengue and its impact, they really come to understand their roles that have to play. Knowing that youth are expected to live much longer. So if we tell them that if we are not going to combat dengue, that means you are going to be in a position to be affected for quite a long time. That means we may not be able even to reach our dreams, that we may not be able to do some of our activities. Now people come to understand that the sustainability comes from these groups of people to understand the impact of dengue. You know, investing on a bright future, it is in the dreams and aspects of every young leader. So knowing that dengue can become a limiting factor for many of youth not to achieve their dreams, it makes them quite involved and perform those several initiatives. So one of the things that we have also been doing, for example, when I was having some consultation with the parliamentarians caucus with the Ministry of Health, is that we need now to have sustainable policies that will help to carry these dreams for quite a long time. As we have seen, for example, this year has been a momentous year for NTDs, setting programs for almost for 1 year, like for 10 years, like we're having a roadmap for 10 years. Now, when we are returning it, in order to make it sustainable, we are calling it our countries to have this, we call that country ownership. A country ownership is one of the ways that these plans of fighting dengue can be sustainable. If we are not going to have the country ownership, then we are not going to have sustainable ways. So we are really calling for our countries to have country ownership so that our plans can be sustainable. You know, we are here today, we are not there tomorrow. So in order to make these things sustainable, we need to have a country ownership, sustainable policies, and everyone in our society is straight on us. So one of the things I'm doing is to make our people understand the impacts of dengue and how are they going to affect their dreams. So that we call for over 60% of youth in our SARDIC region to understand and play roles. And one of the things we are doing now is whenever we talk of malaria, we talk of dengue as well. Whenever we talk of malaria, we talk of dengue as well, because they're all vector-borne diseases. So as they are concentrating on malaria and the impacts, they also concentrate on dengue and the impacts. Yes.
Yeah, that's a great answer. I mean, some of the audience, I'll bring some of the questions in from the audience that they're making some comments there that they're wondering, someone's an anonymous person is wondering if anybody's heard of the Korean model. Is anybody benchmarking the Korean model? They're calling it the New Village Movement, which is modernizing the rural areas. I personally haven't heard of that, but there's a question that's come. I don't know if any of the panelists have heard of that as well, but there are these movements occurring in a kind of fractured way across. And so Dr. Karam Wahid is asking, I suppose I'm going to bring that question into this, because there are so many different communities across the world suffering from dengue. They're all engaged at some level or another, or at least they're on the road towards further engagement. Is there a need for a kind of framework for intersectorial collaboration that, let's say, LMIC settings, resource poor settings can lean onto and kind of, develop stronger community engagement? I learn from each other. Do we need to have a kind of platform in place? Derek, you mentioned this, your Dengue Academy. From, what are your views on a kind of a global framework that people can kind of lean onto, learn from, and then develop in terms of their own kind of actual needs, targeted needs at their community levels? What's your view on that? Do we need a global kind of repository? I don't know what the word is exactly, hub, somewhere that people can put in their kind of experiences and discuss and have discourse around that?
Yeah, I think we do need a mechanism, and I see it as a mechanism for sharing. We actually have lots of good examples of how we engage with communities well, and the kind of the positive impacts of that engagement. We also have lots of examples of where we've engaged poorly with communities and the negative consequences of that. Things like vaccine hesitancy, I think, is in large part a sort of a failure of community engagement. In terms of good examples, I think Sita, you gave your one with the school apps. This is a way of engaging schools and people who aren't normally part of sort of health control or sort of public health, whether it's construction industries, housewives, schools. So we have good examples where we've managed that engagement, and we can then measure the impact of that engagement. We have it in the context of clinical trials. It's a necessary part of clinical trials. Again, I see that you gave the example of the Takeda study in Sri Lanka with 98% retention over 4 years. You can't have that kind of retention of children in a clinical study, which involves weekly febrile surveillance, without a high level of community engagement. Cameron, you mentioned Wolbachia and how part of the success of Wolbachia's investigations is that community engagement. So I think what we need to do is actually recognise that we all have a common target, and that common target is a reduction of dengue. And to get there, we can't do it alone.
Yeah.
People have been fighting dengue for decades, and yet dengue is still, worsening. It's spreading. So if it's spreading despite, decades of work, then we need to be seeing this more holistically, and that involves, significant kind of partnership, significant kind of assessment of what's worked well and has worked poorly, and then applying those lessons into the very specific situations of local communities. And in that, industry has definitely a part to play, particularly around education and the provision of transparent data. But also, we understand how to assess the impacts of interventions. So that impact has to go beyond simple vaccines or simple, Wolbachia, and looking at these things together. And in that, sustainability component really requires ownership, and pharma, can't own that. That has to be owned by the communities with the support of key components of that community, particularly governments and health authorities.
It's a great answer. Jean-Antoine, if I could bring you in because of the experience you've got and you're amassing there.
No, to react on your idea to have a platform, I think I do believe in cross-pollination. We definitely need to take advantage of the experience of one another, and something that is done in Africa can be very useful in Asia and vice versa. So definitely, if we can have this type of platform to exchange experience, that will probably save time, resource, and energy to many of the stakeholders. Second, we are focusing on the pharma industry, but it's not only the pharma industry that should get involved. You have all those involved in, plastic bottles and all the tire industry, etc., etc. We need to find a way to find them concerned about the issue and involved in that. It's only if we have multiple stakeholders that we can change the mindset and help people adopting new behavior. And therefore, the pharma industry alone cannot do it. The NGO cannot do it on their own. The government cannot do it on their own. We all need to come together, discuss, and have a common plan, and everybody contribute to this plan.
And that's a fantastic answer, and I think that's really. I think that fills one with a lot of hope in terms of the future for dengue. This willingness just to have both of Derek and Jean-Antoine sat on the same panel as an example from our point of view is a fantastic kind of starting point when we're talking about communities. Couldn't agree with you more. This is not just a pharma industry issue. This is absolutely not that. This exactly, I could not agree with that statement more. I suppose then the question becomes a question of credibility and a question of, if we have these platforms, how credible will they be for the communities? And I suppose that question then goes to Hasitha, back to you from a government. Should this be a government, I know you worked very, very well with the Pakistani Ministry of Health. I introduced you as a star there. That's an understatement. That you're absolutely loved, adored there by the people, especially in Lahore. You managed to help them save so many lives. So there is appetite for cross-government working. So is this type of, let's say, global framework, global repository, kind of sharing platform where communities can engage and develop some kind of rapport with each other, and are on the road to co-creating assets that can be used to further education on dengue? Is this something the governments should be looking at, Hasitha? I'm not going to put you on the spot because I know I'm going to get a lot of trouble for that, but in terms of your personal kind of view on that, what would it be?
Yeah, you setting the stage for my next talk in the next session, Kamran. Thank you so much for doing that.
There you go.
Because that's exactly what I'm going to talk about in the next session, and probably the last talk of the day, and this whole exercise that we've been having for the last 3 days. So basically, global march towards ending the neglect for dengue is the topic that I chose to talk about. And that's where we're probably heading. And as Derek said, we've been neglected for decades, and we're still, trying to get there. Whereas, certain other diseases just get, they have a smooth sailing. So why is that? How do we change the setting, the tone, and try to work together in tandem? It's not easy. it's not easy because we have different interests. The governments have their own interests. The industry, they have their interest for their industry, and the communities, they have their own interests. So it's kind of a top-down and a horizontal cross-cutting approach that we need to have on board, so that everyone try to aim at a common goal. So it's dengue has been talked about as a role model, silver lining of communicable diseases. If you have a situation where dengue is tackled in a particular community, or for that matter country, your public health and communicable disease programs are probably, it's a proxy of good public health programs. So on that premise, I mean, this is the way forward. There is no other way we'll reach that goal of having better communities, having disease-free communities. Because I've personally experienced so many children dying with their parents praying for their lives and asking for assistance. That was, I mean, that's unbearable for a parent to see how their kids just die with very little help that the system can offer. So how do we prevent that? I mean, it's not a very comforting story. We have come far, through that process, and then still every now and then we see the horror of epidemics bringing the community and the governments to standstill. You brought in the example of Punjab in Lahore in 2011, which I'm probably going to talk about little bit about also in the next talk. But having said that, the entire machinery was at a standstill because they were looking for answers, and people were coming in large numbers to hospitals in search of medical assistance, and here was a situation where we were having 5,000 to 6,000 patients seeking medical attention a day, and large number of people having complications who needed ICU and high dependency care, and a substantial number of people succumbing to the illness. So that's the horror of dengue epidemics. So I mean, it's not a thing that comes every day, but when it hits you, it really hits you hard. So that is why the policymakers and advocates are not taking a closer look at this kind of problems, because they are not handling a situation of this nature on a daily basis. But the communities do. The communities have to negotiate with this on a day in, day out kind of basis. So we need to be with the community on this and try to take this forward. Otherwise, I'll completely tell everything that I'm going to tell in my next talk.
I was going to say,
get prepared.
Why not? Let's cross-pollinate. Absolutely. But I mean, that's a fantastically honest answer in terms of the deficits at policy level and the kind of the horror story of the real lived experience of those communities. So I suppose that kind of alludes itself to the kind of solution to that in part, and that is a co-created kind of asset or a co-creation mindset. So you involve the community to create these assets that can tell those stories of horror, that can tell that kind of convey what it really means to them. And I suppose I'll ask this question to bring back in Mishek and our friend Maximilian. In terms of co-creation of assets, we've heard from Derek, we've heard from Jean-Antoine, not just the desire, but the actual reality of them actually moving forward and doing things with community in a big way. The schools project that Jean-Antoine and the success of that in the Philippines, Derek, and the fact that they're not just looking at the central role of community, but they put this kind of Dengue Academy, they've committed to some resource there in terms of Dengue Academy. In terms of co-creation and driving sustainability forwards, it's not just coming from one direction, it's involving this widening definition of community. Mishek, and Max, what would be some kind of co-created from your youth perspective? I mean, you've heard from industry, they want to do it. What kind of ideas could you put forward in terms of co-created assets that could tell the story of the community, that could kind of rebalance the deficit at policy level in terms of what does dengue mean to our people? Could you give us some kind of light into that? Perhaps Mishak first, in terms of co-created assets using the community. Mishak, I don't know if
Thank you. Thank you very much. One of the aspirations of our model is to say, whatever you do, the community must be the answer. You know, which means Max has spoken about the issue of ownership. So if you want to come out with something that is sustainable in a community, first of all, it's not about bringing something that appears to be foreign to them. They have to understand it, and they have to know that this issue is affecting us. It's issue that is within that has an implication both towards our lives and towards our future. So if you bring that to the table, whatever that you are going to come out with to say this is an initiative which is being called maybe a youth advocacy program on dengue, or a youth arts group on dengue, or whatever form, they know that they are doing it in particular for their cause, not for someone's cause, but they are solving that particular problem.
You're mute. You've muted, Mishak. Sorry, I don't know.
By aspect of that, you are bringing the solutions. You are not bringing the solution as an individual. The community itself, it's bringing a solution. What is there is the information that they've got that we have this issue, but then they come forward to say, how best can we as a community? So in terms of the answering the second question of sustainability, anything that is community ownership, they've got sustainability, because they take that initiative as their initiative. They don't wait for someone to come and respond. They don't wait for anyone to bring ideas, but they say, how best can we move with this? So they bring different stakeholders. If it is in a rural setup, the leaders, among others. So this is how best co-creation can be, where that those experts also bring experts, but ownership is the answer.
Cameron, if I can rebound on that, because for us it's very important. We are not coming to the community with a program already set and we say, okay, apply this. No, we start with a dialogue. We understand where the need is and we co-construct the project with them. And in this co-construction, they get deeply involved and they ensure the sustainability of the project.
I totally agree. I was going to make exactly the same point, Jean-Antoine, because you know, this idea that we can have some global solution that's decided somewhere and then implemented somewhere else, I think is doomed to failure. We need to understand, first of all, how those communities work. We see big differences in in the source of trusted information in different settings. In some places, Asia Pacific, tends to be more social media. We see in Latin America that trusted source of information are more ministries of health and kind of more traditional sources of information. So we need to understand exactly who are the trusted figures. How do we understand dissemination of information within that community? It's very much a co-creation. I think that's a key part of sustainability as well, because that co-creation creates ownership.
Yeah, that's a fantastic answer. I think the co-creation was really exemplified by what Jean-Antoine was speaking about in schools, and I wish we had more time to go into it. But I think I'm being asked by the support team at Advocate to really have to wrap this up, because we've gone over slightly, and there's a few minutes left, until the next session. So I will come to the conclusion. But some of the audience feedback we've had: great work, really good work by Sanofi, and that was in reference to what you were saying, Jean-Antoine, earlier. Really good discussion and fruitful discussion in this session. There's an appetite. I mean, before this turns into a love fest in terms of we're all listening to each other, there's an appetite on both sides for engagement. That's very obvious. And the kind of meshing into what works and what doesn't work, I think, is the kind of almost the footsteps in the air, and what's coming down is this whole kind of concrete, let's co-create, work together and make something actually happen. And so I'd be very interested to revisit this in a year from now, 2 years from now, to see what's coming out then. I'm sure there's going to be a lot of different Mishek, you put arts, the broad term arts and culture up there earlier. I'm sure there's going to be a lot of different kind of inputs that are going to really transform the way we all approach dengue and ultimately reduce that disease burden. So from the International Society of NTDs here in London, ADVA, on behalf of ADVA and everyone, I'd like to say a huge thank you to all the panelists who have made time today. Dr. Tissera from a very busy schedule at the ministry level in Sri Lanka, Jean-Antoine Zanzo from the Sanofi country level at the Philippines, Derek Wallace from Takeda in terms of the Takeda lead there for Takeda. Thank you very much. We've had a great input from Mishek Gondo, regional advisor for SADC, and of course Maximilian Godwin. So thank you all very much. I think we're going to have to stop. I'm going to get in a lot of trouble. Professor Lulu Bravo's appeared. I'm in trouble. Okay, so thank you very much, everybody. All right.
Thank you.